Good morning, Nevada. This is Healthy Nevada with Tina Drago and Jim Godwin. Today we have a special guest with us, Amanda Moya from Northern Nevada Hopes. Amanda's going to talk to us about all the progress they're making up north. Hello, Amanda.
Hi.
How are you doing today?
And hello, Amanda.
Hi, Jim.
And a big hello to all of our listeners out there in Radio Land. So, Amanda, as much as I'd love to introduce people, I'm going to let you have the privilege of introducing yourself and what you do at Northern Nevada Hopes.
Sure. So I am the Director of Marketing at Northern Nevada Hopes, and I've been in this position for about 3.5 years. And Hopes has been around since 1997, and we recently have expanded and opened a brand new $13 million medical facility. So we're going through lots of growth, and it's very exciting.
That's phenomenal.
Nice.
How did Hopes initially start? What were they?
So initially, back in 1997, Hope started as an HIV service organization, and in 2012 expanded into a primary care facility.
Excellent. Excellent. So you saw a lot of growth and demand up there?
Oh, definitely.
In Reno land? You're up in Reno, right?
In Reno, yes. We're located in downtown Reno, Nevada.
Cool. Do you want to tell us a little bit more about Hopes and what you guys do in the community?
Sure. So like I said, we expanded in 2012 into a primary care facility. So in addition to serving HIV patients, we started seeing the general public. And so we're a community health center, and we're also a federally qualified health center. So we serve people with insurance and without insurance. And we have about 5,000 patients right now that we serve in Northern Nevada.
Oh, wow.
We provide a variety of healthcare services, everything from primary care and behavioral health counseling to social services, and we also have an on-site pharmacy. And we're really focused on just providing very low barrier, easy access to healthcare.
So you just finished a $13 million building?
We did.
Tell us.
All of 2015. Yeah, go ahead.
Tell us what it was, really, what made you go in that direction and all the services that it provides.
Well, as we opened our doors to the general community, we realized that there was a major demand for healthcare, for affordable healthcare. And we pretty quickly started to outgrow our space. And I mean, when we had HIV patients only, we had about 600 patients, and now we're at 5,000. So in just a few years, we really, really grew. And so in 2015, we spent the entire year constructing a brand new facility. And like I said, it's $13 million. We went through a capital campaign to raise some of the funds, and we also had the support of the state of Nevada's new market tax credit program. And so this new building, it's 38,000 square feet, 3 stories, and it has 32 exam rooms, 3 separate clinic pods, and it's just a really, really great addition to the downtown Reno area, and we really think it's going to help revitalize the area.
Do HIV patients have a different level of care than the average patient with diabetes and hypertension?
You know, they do, and that's something that we try to model our healthcare services around. HIV patients require a lot more wraparound services, so things like medical transportation to their appointments, having an on-site pharmacy, just all of those things that really make healthcare low barrier and really put the patient at the center of their healthcare.
So when an HIV patient comes in, do people, I guess, are you identified as an HIV clinic to the neighborhood, or are you identified as a community health center to the neighborhood?
You know, that's a great question, and that's something that we've been kind of, trying to figure out as we expanded. We went through an entire rebranding process, and it's still, we're a community health center, and we still see HIV patients, but now that's just a fraction of who we're serving. And so, raising awareness so that anyone can come to Hopes for Care, that's still something that we're always working on.
So the stigma is depleting, or you're trying to remove that stigma?
I think that expanding into primary care has helped because now if somebody's coming to Hopes, they're not necessarily coming for HIV. It could be just a kid, or it could be a family who's coming for healthcare services, and I think it's helping to alleviate some of that stigma. But in certain areas, it's still prevalent. It's still an issue.
Do you find your families enjoy the fact that they're all inclusive, that everybody in the family can be seen at the same provider at the same organization and community health center?
I do, and I think that's a major draw for community health centers like Hope's, that it's health care for the entire family, and so everyone from a child to a senior can access health care.
So, Jim, you do the marketing for the state of Nevada. How do you see us promoting this?
Say that again, Tina?
I said you're in charge of making sure the entire state of Nevada knows about all the services that are being offered.
I know. I try very hard.
So how are you spending?
That's why we have Amanda on the show to help spread the word.
Yeah.
And one thing I did want to ask you, Amanda, just because I'm curious, and I think a lot of the people would like to hear some of the stuff that Hopes does that's slightly different from other medical providers in the community, some of the stuff you do for substance abuse and the homeless population.
Right. So about 20% of our patients right now are...
Wait, Amanda, can I ask you to speak up?
Yes, go ahead.
Can I ask you to...
Sure.
Yeah, please speak up. Okay.
Yeah. So about 20% of our patients right now are experiencing homelessness. And so that's a major group that we're focusing on, underserved, people living in poverty, the homeless. And we also recently opened a syringe services program. So it's the first legal syringe service program in the state of Nevada. And what we do is we accept used syringes from injection drug users, and we provide them with sterile syringes. And when they come to Hopes, we connect them to substance use treatment resources, healthcare, and it's a big focus is about eliminating the transmission of HIV and hepatitis C.
Do you know, I told the Southern Nevada Health District that you were doing that needle exchange program, and they were blown away. They didn't even think anybody in the state was doing it. And I'm sure you're going to get a call from them wanting to know how they can implement that program down here. So bravo to you.
Great.
Yes.
That is very cool. It is a great program. So I am curious because just operating a health center is a complex and daunting task. And I was wondering how you guys managed to continue working through the year of construction for your new medical center.
Right. Well, it was just over a year, and we actually constructed a temporary modular clinic. So we had a trailer on site right next to the construction site. And it was very close quarters for a lot of our staff and our patients. But, we had that light at the end of the tunnel. And so we just, kind of powered through the last year. And now we have this great new medical facility, and all of our patients and our staff can enjoy it. So, yeah, it was definitely a challenging year, but it was worth it.
Sounds fulfilling.
And very exciting. Your new building is beautiful.
I saw pictures.
And amazing. Speaking of your new building, which holds which is for a community health center, do you want to just touch on some of the things that make why community health centers are so important?
Yeah, and I mean, Jim, you know all about this.
I sure do. I live it.
You live it, yes. So I think a lot of people, still might not know what community health centers are. And it's, they're just such a great resource for cities. And one of the things that makes them different is that they're, like I said before, all about being very low barrier, easy access. because as we all know, healthcare is something that people, put off, and so we're all about making it convenient and really providing that support for people to navigate the healthcare system, which is often confusing and complex, and it takes a lot of time. So health centers, like Hope's, we provide all of our services in one location, so that really eliminates the need to go from different providers in the area. So everything you have is on site, and so we have primary care, social services, on-site case managers, and all of our healthcare providers are working together in a team. So you have your pharmacist talking to your doctors and your and social workers. So it's all very, very integrated and comprehensive.
Do you also do behavioral?
We do. We have an on-site behavioral health team, and it's a huge need in the community. So we're very fortunate to have that on-site and to be able to offer that to our patients.
I know down in Las Vegas here at our clinic, First Person, we really rely on our behavioral health program to work with and to help our primary cares keep our patients on task and make sure they stay compliant, because there's so much more than just the body. I mean, you really have to mentally be behind it.
Right, exactly.
So they work in your team.
Go on, Tina.
I was going to say, so they work in your team as well.
They do, and that's a big part of what we're doing, is making everything integrated so that wellness and medical services are, they're one and the same. They're something that we really try to bring together.
That's excellent.
It's still...
Go on, Bob.
I've said it before, and I will say it again. It still blows my mind that there has to be a push to integrate behavioral health with the physical health. And I applaud everybody that's doing it. It's so important to get that holistic view of health and treat everything, because it's all interconnected, much like life on this planet. And so I think it's great, and it just blows my mind that people have to talk about it, that it's not just a given.
Right.
So
I love you took it to the cosmic level, great. Jim. You took it to the cosmic level. I love it.
I did. Well, my segues were a little bit lacking, and I said, Jim, let's get cosmic on these people, and I did.
That is awesome.
I hope everyone can handle it.
So, Amanda, one of the hurdles is that the government has yet to allow for dual billing in the same day. So when a patient comes in and they see a behavioral, and then they see a primary care, can you still only bill for one? Or is there headway being made that you can actually bill for both providers in that same day?
That is a great question, and something that I will have to get back to you on. But I know one thing, that when we have a patient come in and they have a doctor's appointment, we do have the behavioral health providers and also our case managers who work in our social services department. They do check in with the patient during their medical visit. So whether or not it's something that we can bill for at the same time, it's something that we're integrating. So
I just say that because you had mentioned transportation is one of the issues that burdens this population. So you would think when they come,
it's a huge issue.
Yeah, when you finally can get them into the office, you want to take care of everything.
Right.
Right. But you should be paid to take care of everything. If a specialist is, behavioral psychologist is coming in, or a clinical licensed psychologist, they should be paid just like a primary care doctor.
Right. I agree completely.
That's my PSA announcement.
That was a great point and a great question, Tina.
Well, I know they're trying to work on it. I know they're making headways. I just, I never think it's fast enough, because in the long run, it's the people that are suffering, and it's the programs out there that are not being funded adequately. If we were putting a monkey on the moon, we'd have a lot more funding than trying to get somebody to be paid for the care. Yeah, monkeys are adorable. So tell us about your patient population. Are they primarily male? Are they young? Are they old? Are they a mix?
Well, we just started seeing pediatric patients this year, actually, and we opened our doors in the new building on February 1st. I don't think I mentioned that. So it's just been a few short weeks in the new building, and so we are serving kids now. A large amount of our patients are baby boomers, so they're in their 50s and 60s, and a large amount are also low-income patients. So their families living on incomes below $30,000 a year. And like I said before, about 20 to 25% are homeless.
So you have that mixture of the baby boomers. We have that down here. They're a large underinsured and uninsured population.
Right.
And when you look at it, they're the ones with the highest medical fees, with the comorbidities, the diabetes, the hypertension. So they become a tax burden. So we want to be able to take care of them, right?
Yes, definitely. Yes.
So your programs revolve around that as well?
Yes, and one of the things that we do, speaking of baby boomers, is we offer free hepatitis C testing, and so that's something that a lot of people, they are unaware that they're living with hepatitis C until they get into their later years, and so that's something that we're really trying to tackle up here in Northern Nevada.
So if they test positive, do you have programs and resources for them?
We do, and we're very lucky to have Dr. Charles Krasner. He's a hepatitis C specialist, and we offer on-site treatment through our pharmacy as well for hepatitis C.
That's fascinating, and that's a great point that you make, that there are other diseases out there that the homeless population has to deal with, and that's one of the bigger ones. Do you find that the needle share program in conjunction with the hepatitis C is really making headway up there?
Oh, it really is. One of the things that we try to do with our syringe service program participants is we provide them with testing every time they come in and do an exchange. And as a result, we've found several people who are hepatitis C positive, and we've been able to link them directly into treatment at Hope.
That's phenomenal. Wow. You got to feel good about that.
Oh, yeah.
Just making the world a better place.
So up in Reno, how many federally qualified community health centers are there?
Maybe Jim can help me with this one. As far as I know,
we have 3 or 2 up in Reno, Community Health Alliance and Northern Nevada Hopes. And then in Carson City and Virginia City, we also have some community health centers from Nevada Health Centers.
Excellent.
So Nevada as a whole has 6 community health centers, federally qualified health centers, with 29 sites operating statewide. You
keep forgetting me, Jim. You keep forgetting me.
And we also have this brilliant federally qualified health center lookalike.
Yes.
Called First Person that Tina, I was just amazed because I sounded smart for a minute in the interview. I was like, this is my time to shine.
I'm shining, but I forgot Tina. Oh, my gosh. Yeah, I won't.
Yeah, you asked a great question. Right before that, I was about to ask whether her stapler was a swing line or not. And then you came in with the great dual payment. So I was really excited to come in and sound smart for a minute.
Okay, so the swing line?
And we look forward to First Person joining the FQHC ranks.
Sooner or later. It's a long little road.
Sooner or later.
Yeah. What were you going to ask? What was your brilliant question you were going to ask, Jim?
Who, me?
Yeah.
Well, I was just going to ask if her stapler was a swing line.
It is.
Those are the best.
Thank you for asking, Jim.
Yeah, you're welcome. When you want papers to stick together, you got to do it with the best equipment possible. Hopefully that part can be edited out.
Do we have...
I did want to say that if you want to learn more about Hopes, they have a Facebook page for Northern Nevada Hopes, which is excellent and has some great pictures and footage and updates on the progress of their new building. And they also have a phenomenal website as well. I believe that's nnhopes.org, Amanda?
That's right. Yep, nnhopes.
That is correct.
Say it again, Amanda.
It's nnhopes.org.
And if people want to call you, your number?
My number is 775-997-7533.
And I also, while we're talking about that, if someone wanted to support Hope or help y'all out in this great mission that you guys are driving for, how can they support Hope's, and why would they want to?
Well, a few things. We have our grand opening ceremony on March 15th right here in our new building. It's 11 a.m. to 1 p.m., so it's open to the community, so anybody who's in the area can stop by and check out our new building. And we're still running our capital campaign for the new facility up until the grand opening, so we have patient exam rooms available for naming opportunities, and anyone who is interested can get in contact with us. And then just becoming a patient at Hope's is always a great support to us and to any community health center. That's pretty much it.
Now, people are going to ask, are you Ryan White funded? Have you had Ryan White support throughout this?
Yes, and we are still Ryan White funded. And we do still serve HIV patients, and we provide free HIV testing to the community, so that's still something that's very essential to our mission.
That's phenomenal. And do you plan on leaving the Reno area and expanding? I know you just got the building.
That's another great question. I'm sure that's something that's being considered as we speak. So, I think that would be a great thing for all of Nevada in the future.
Wonderful. Wonderful. Jim, do you have any pearls of wisdom?
I just have, I see we're running a little late on time. I just have one quick important question for you, Amanda, that I want to know, and I think a lot of our listeners would like to know. Does your office still have that new office smell?
It does, yes, and it's great.
Outstanding. Cherish that.
You know what? I had one question, and I didn't ask it, and I want to ask it now. Do you, because Reno is like right there on the border of California and Nevada, do you find that you have patients coming from California?
You know, we get a lot of California transplants, so people who are new to the area.
Okay.
That's something that we see a lot of, yeah.
But not living in one area and coming over the border.
You know, not so much. We might get some from Truckee every now and then, but as far as I know, it's mostly Nevada.
Yeah, there's a lot of mountains in between.
Yeah, well, you're providing great services, so I would think people would test those mountains just to come to you. They bother me a little. I kind of like the flat ground. When I go up to Tahoe, it's a little scary. So I really appreciate Jim Godwin with the Nevada Primary Care Association and Amanda Moya. I'm saying that correct, right? Amanda?
You are, yes.
And Amanda Moya with Northern Nevada Hopes. And this is Tina Drago with First Person Complete Care, coming to you from the Beasley Broadcast Studio A in Las Vegas. And we're here to give you more information, resources, and education about the primary care, community health center, and FQHCs in your community. Thank you both for being on the show today. I appreciate it.
Oh, thank you for having us.
Thank you so much.
Take care and have a wonderful day.